Good afternoon. Thank you, Paul. Let me first begin by expressing my gratitude to the World Federation of Public Health Association for inviting me, my organization, to address this World Congress. The contribution of my organization, the Comprehensive Nuclear Test Ban Treaty Organization, to your deliberation might not be that obvious. I must admit, because Paul has mentioned a chemical weapon. We know now what unfortunately happened in Syria, so it would have been good to have Ambassador Zumshu with us. He's not here. I know that Matthew will Paul will cover for him. But I'll try and take you through what we've done so far in terms of nuclear test monitoring, and then how that fits a little bit in public health issues. So let's remember that this year we'll see the commemoration of the 72nd anniversary of the bombing of Hiroshima and Nagasaki. In fact, I just got back from Nagasaki this morning. So to this day, nuclear weapons have never been used again in war. Unfortunately, however, human suffering from nuclear weapons was not confined only to Hiroshima and Nagasaki. From 1946 to today, more than 2,000 nuclear test explosions were conducted. And that's something that the international community, especially now, people tend to forget. When we talk to young generation today, when you talk about nuclear testing, they wonder what that means. What they know, it's nuclear weapon, the use of nuclear weapon as they see it in movies. But I think we shouldn't forget that about 2,000 tests were conducted. But conducted in the atmosphere, underground, and underwater, and in the outer space as well. During the 50s and the 60s, nuclear tests were carried out in the Montebello Island of the Western Australian coast, and at Emu Field and Maralinga in South Australia. About 75% of these all nuclear tests were conducted underground. Underground for a reason that I will explain, because we had a partial test ban treaty that stopped atmospheric tests because of the consequences on humanity. So the remaining one was set off, as I say, in the air. Tests alone accounted for 428 megatons of explosive power set free, which is equivalent of 29,000 Hiroshima-sized bombs. And that's something that we tend to not assess well. At least we don't figure it as we should. And then to try and estimate a little bit what a disaster this has been and could be for the environment. So the amount of radioactivity generated by a nuclear explosion can vary depending on the design and the location of the burst. Atmospheric tests cause fission products that lead to contamination of the atmosphere and Earth's surface. With the phenomenon of radioactive fallout, particles from the nuclear test explosion travel at great distance before falling to Earth. The radionuclide dispersed, characterized by different periods of decay and emission rates, can affect human body in various ways. Prior to 1950, little consideration was given to the health impacts of worldwide dispersion of radioactivity from nuclear testing. It was a husband and wife team of physicians in the United States, Eric and Louise Rice, that initiated groundbreaking research. Through their baby tooth survey, the team collected over 300,000 teeth from children of various ages across the United States. The result showed a steady rise in strontium-90 throughout the country, peaking at around 50 times higher than that in children born before the advent of large-scale atmospheric testing. As you may know, studies have shown a causal link between the exposure of strontium-90 and the risk of contracting leukemia, a hideous disease that may reveal itself even decades after the exposure. Another isotope produced by nuclear fission, iodine-131, can be transferred to nursing infant via mother's breast milk and through the consumption of dairy products. Children are especially endangered as iodine-131 accumulates in the thyroid. The International Physician for the Prevention of Nuclear War estimated that over 20,000 children may have been exposed. A study conducted by the U.S. Center for Disease Control and Prevention and the U.S. National Institute concluded that every human being born since 1951 in the United States has been exposed internally and externally to radiation from the nuclear tests conducted at the Nevada test site. In particular, people exposed to iodine-131 may have increased risk of thyroid disease, including cancer. So I'm not saying this to cause any problem for those who are born in that period, but I mean, those are facts that we have to talk about anyway. It has also been scientifically demonstrated that radioactive particles from nuclear testing during the Cold War still persist in the air, even though they seem not to be harmful for people at this altitude. These plutonium and cesium radionuclide kept in the upper atmosphere can be driven down by atmospheric events. A 1991 study by the International Physician for the Prevention of Nuclear War estimated that the radiation and radioactive material from atmospheric testing up until the year 2000 could cause 430,000 cancer deaths, some of which had already occurred by the time the results were published. The study predicted that roughly 2.4 million people could eventually die from cancer as a result of atmospheric testing. In fact, Prime Minister Jawaharlal Nehru was the first statesman to call for a halt of nuclear explosion testing in 1954. And that's when the story of the Comprehensive Test Ban Treaty started. Concerned with the emergence of hydrogen bombs and the destructive forces that were unleashed during the testing of such weapons, as well as the consequences on human health and the environment, Nehru called for a standstill agreement. Pending a full prohibition of the weapon themselves, increasing public pressure, and the sobering experience of the Cuban Missile Crisis, in which the superpower found themselves at the brink of a nuclear war, eventually led to the conclusion of what I just mentioned, the Partial Test Ban Treaty in 1963, the PTBT. The preamble of the PTBT lists as one of its objectives to put an end to the contamination of man's environment by radioactive substances. While the PTBT drove testing underground, it merely reduced the emission of nuclear testing. Its impact was attenuated by the fact that 70% of all nuclear tests were then conducted after 1963 and at an increasing number of locations. So, while underground testing mitigated the problem of radiation doses from short-lived radionuclide, such as iodine-131, large amount of plutonium, iodine-129, and cesium-137 were released underground. In addition, exposure occurred beyond the test site in radioactive gases leaked or were vented unexpectedly. Moreover, It has also been found that despite earlier beliefs that underground testing can contaminate groundwater sources for long period of time after the underground tests happen. One of the most long-lived isotope is plutonium-239, one of the fissile material used in nuclear weapons. Its half-life is 24,000 years, the same time span to which some anthropologists backdate the death of the last Neanderthal on the Iberian Peninsula. The human health and environment consequences of nuclear testing are clear, both in the air and underground. While generations to come will continue to be plagued by the legacy of nuclear testing, the humanitarian impacts of more than 2,000 tests played a significant role in securing the conclusion now of the Comprehensive Test Ban Treaty in 1996, which my organization represents, which represent also the treaty that Paul Walker mentioned, yet to enter into force. While this treaty has to become a global law due to its demanding entry into force clause, it has been signed by 183 countries, 94% of all nations that adhere to it as if it had. The only country to still conduct nuclear testing in our millennium is, you all know, the Democratic Republic of Korea. And then as we speak, there are still talks and indication that they may conduct another nuclear test explosion in a couple of days or a week. And these actions contribute to making it one of the most isolated countries in the world. And while the DPRK has conducted 5 tests since 2006, including two last year, a fully enforced and implemented comprehensive test ban treaty offers a credible promise of a world without the menace of nuclear weapon testing. However, without the treaty in force, there is no guarantee that nuclear testing and the related arms race will not resume. The impact of such a scenario would be disastrous, not only for international security, but also in terms of human health and environment. Ladies and gentlemen, the CTBTO contributes to human health and safety in other ways as well. As you see in the slide up here, we have a network of over 300 facilities around the globe covering 4 technologies that are monitoring day in and day night what's happening in the air, underground, underwater. And why we say that with the treaty can verify compliance, we have established this network for the past 20 years, and those stations send data in near real time with unrivaled reliability and precision. That data has proved its usefulness not only for nuclear test monitoring, but also for disaster warning and scientific research. At present, for example, 14 tsunami warning centers in 13 countries make use of our data to issue more timely and more precise warnings. Former Secretary General Ban Ki-moon once said, even before entering into force, the Comprehensive Test Ban Treaty is saving lives. So the system also features 80 stations that can detect minute traces of radioactivity. The radionuclide network can detect residual radiation dispersed by the wind, as well as the noble gas that might seep through the earth from underground tests. Apart from detecting nuclear explosion, this station will also register the dispersion of radioactivity stemming from other sources anywhere in the world. For example, nuclear power plant accident, and then I'll come to that to give you an example on Fukushima with a specific slide. One of my analysts even claimed to be able to detect pedestrians having received radiotherapy passing nearby one of our detectors. So by using atmospheric transport modeling and meteorological data, this is what we see for the Fukushima accident. Let me mention here that for Fukushima, the 4 technology that we're using for monitoring potential nuclear test explosion were put to test. Our seismic station were able to immediately detect the earthquake that generated the tsunami, and the infrasound technology was able to give the proof that the nuclear power plant had exploded. And then the radionuclear technology was able to follow the dispersion of radioactive material around the globe, as you can see from the station that are spread in the globe. And that was how we follow the different level of radioactivity, and that could be used by many in the international community to see how far that could impact health. But let me say that we're not dealing specifically with the level that could impact health. We're making our data available to whatever scientific institution needs it for their own use. And that's how we were in contact with the World Health Organization for them to see how the coverage, the dispersion has gone, and it's up to them to see with the level that they found whether it impacts health or not. Because our job, it's indeed not to do. It's the same for tsunami. When we provide data for tsunami, we're not the one doing the warning, because that will be a big responsibility on the organization, which prime mandate is not this type of issue, but mainly nuclear test explosion. That has been an issue with our state signatory, and that's, I think it's important to mention. So as I said, this information is normally available to the state signatories. The 183 countries that have signed the treaty receive the data in near real time. However, with increasing media requests, I think we've been providing, and what I could say, the data is at the disposal of the international community. But what is the international community here? We have 183 countries, 94% of the world. I think this is the international community. And this is probably why, as many of you have noticed, last year, at the 20th anniversary of the Comprehensive Test Ban Treaty, the United Nations Security Council adopted a resolution, the 2310, in favor of the Comprehensive Test Ban Treaty and then the use of its data for civil and scientific application. So, and then among all, we can talk about earthquake, seismicity, I mentioned tsunami warning, volcanic ash monitoring, and then there are many other issues and many other topics that we cover, but which sometimes brings difficulty with our state signatories with regard to not diverting too much from the prior role of the organization and its verification system that is being built, which is precisely and mainly nuclear test explosion monitoring. The station, when I say that they send data in near real time, let me also mention how far we've gone with regard to data provision to international institutions. We have a provision in our treaty which states that data, we have a couple of different types of stations. We have what we call our auxiliary seismic station, which send data not continuously, only upon request when we have an event, and then we call upon those stations to be able to confine the results, the solution that we're making for an event. But for tsunami warning institutions, they need those stations. But the provision in the treaty normally said that those stations can only send data upon request. But now we're sending those data continuously to tsunami warning organizations for their purpose. We're creating then a problem with the treaty where states who have signed the treaty cannot get those stations continuously, whereby tsunami warning institutions are receiving them continuously. So the problem is, where do we draw the line between the prime mandate of an organization and how we serve the international community for disaster risk reduction or public health? So those are the issues sometimes that we have to deal with in diplomacy, on multilateral diplomacy, and where sometimes science cannot always drive policy, but the organization, the Comprehensive Test Ban Treaty is one of the great examples where we have to use science to drive policy, and then when policy comes on top, sometimes we have difficulty, and that's a problem that we face every day. And this is probably why the treaty is still yet to enter into force. So I've talked about the United States, the Security Council Resolution 2310, which was another problem as well with regard to how far we go with regard to the build-up of the international monitoring system, which is a system that should be ready upon entering into force, how it served the international community while the treaty is yet to enter into force. But I'll take this opportunity to tell you why this treaty is still pending. We have that difficult clause, which is unique in multilateral diplomacy, whereby they've decided that 44 countries, which we call countries in Annex 2 of the treaty, ratification is absolutely necessary for its entry into force. It means that if we had all those 44 countries that have signed and ratified, the treaty would be in force. But why those 44 countries? Simply because those are countries that were supposedly having the potential to develop nuclear weapon or having nuclear technologies. If the treaty was to be negotiated today, instead of 44, maybe we'll have 80 or 85 or 90 countries. So that would make it more difficult. So among those 44 countries, we have 8 remaining. The United States that have signed, China that have signed, Egypt that have signed, Israel, and Iran. Those 5 have signed the treaty. It's only their ratification that is pending. The 3 others, India, Pakistan, and North Korea, have not even signed the treaty. So those are the 8 remaining countries' ratification that is necessary for the entry into force. But even though they haven't signed, but all those countries, through different mechanisms, are receiving data from the international monitoring system and making good use of it for public health. So, Paul, I know that it's sometimes far-reaching to say how the international monitoring system and its network can contribute to public health, but I mean, this is what we do. What we do that is not known well enough, and that's why this is a great opportunity for us to talk about our network, how we contribute, and how Fukushima has been a great example for us to serve the international community, especially the World Health Organization. Thank you.